Health promotion. In this module, we'll cover health promotion, disease prevention, and recommended screenings. We'll also review changes that can occur with age and how health promotion and screening recommendations vary with patient age as well. Patients' individualized plan should consider patients' beliefs and goals, level of function, family, medical, and social history, in addition to standard of care recommendations. As the slide indicates, health promotion is a topic that should be addressed at every visit with patients of all ages. Prevention of disease or detection early enough to minimize complications is a major aspect of primary care. These are aspects to be considered prior to implementation of health screenings, looking at sensitivity, specificity, impact on disease, and cost effectiveness. Cost effectiveness considerations include not only the costs of a screening test, but also costs to patient in time away from work, potential risks associated with the screening itself, and any costs associated with false positive results. Comprehensive screening of every patient can be a challenge. In addition to the considerations discussed on the previous slides, there are also important aspects that influence patient screenings. The most effective screenings are those for common diseases that have a large disease burden. Diseases with long latency periods have potentially greater gains from early detection and screening. To determine the potential gain from a screening or preventive intervention, the following are commonly considered in the calculation: number needed to screen in order to alter the outcome for one person, the absolute and relative impact of screening on disease outcome, cost per year of life saved, and the increase in average life expectancy. These are all population level considerations. Remember the specific considerations discussed earlier for individual patients. Debate continues about when to discontinue routine screening, but it's generally agreed that when life expectancy is less than 10 years, many screenings are no longer appropriate. There are many additional resources beyond those listed here on this slide. Explore these and others to become comfortable with what you want to include in your provision of health promotion and disease prevention services. Current recommendations are for a routine physical exam every 1 to 3 years until a patient reaches age 50, and then a routine exam should be performed yearly. Preventive services are commonly grouped into 3 categories: primary, secondary, and tertiary. This information should be a review from your undergrad education, but as a nurse practitioner, you'll be applying it in a new way. Primary prevention is done to prevent disease. For example, education regarding avoidance of secondhand smoke. Secondary prevention is aimed at early detection of disease in order to enable early, more effective treatment. An example of secondary prevention is a screening test such as mammography or colonoscopy. Tertiary prevention is aimed at preventing complications from an existing health condition, such as rehabilitation for cardiac patients. These topics should, of course, be tailored to the individual patient, but these are topics to cover when providing health promotion services: physical activity, nutrition, safety, sexual behavior, dental health, substance use, and immunizations. With the older adult, actually, that age group has found to be suffering from higher rates of sexually transmitted infections. So don't be stereotypical and think of older people as non-sexual beings. You want to consider including these topics depending upon your particular patient. For physical activity, for patients of all ages, there are multiple barriers to developing a lifestyle that incorporates regular physical activity. I'm sure we're all aware of those. On page 25 of our text, there is a list of health contraindications to exercise that you should be familiar with. And on page 27, there are exercise recommendations for specific diseases and necessary considerations. As a nurse practitioner, you need to be aware of what barriers, contraindications, and considerations exist for your individual patients. There are multiple resources available, both for providers and patients, regarding physical activity or exercise. Actually, providing a patient with a prescription for an exercise program has been shown to be more effective than simply informing a patient of your recommendations or providing oral education on the benefits of exercise. So that is something you might want to consider incorporating into your practice. Each of these areas should be included in health promotion discussions. The patient's age and individual risk factors, family, and social history will impact how to individualize your discussion and the education provided. But nutrition, education, sexual behavior, and dental needs. Dental, in particular, can be difficult for those with financial constraints. Substance use. Encourage smoking cessation for patients of all ages. Provide them with resources available to assist them with their cessation efforts. As patients age or are prescribed more medications, you need to be aware of risks associated with alcohol use and drug interactions. Don't assume older patients don't abuse drugs or alcohol. A trusting relationship with your patients is important and required if you wish them to be forthcoming about their use of substances. Immunizations. Excuse me. Many adults are behind in recommended booster immunizations. Annual influenza immunizations are recommended for most adult patients, but are particularly important for those with chronic health conditions. Patients 65 years or older should have the pneumococcal vaccine. Zoster vaccine is recommended for patients 60 years of age or more, but finances may be a concern, as they're quite expensive. Travel to underdeveloped or tropical locales may require specific immunizations. Our text has an extensive section on immunizations and other health considerations related to travel that you should review. It is interesting to note that tourists are 10% more likely to die from trauma than from infectious disease. Therefore, it is important for us to discuss travel safety with our patients. In addition, food, water, insect-borne diseases are also a threat when patients travel to tropical or underdeveloped areas, so we need to be aware of how to counsel them on avoiding those as well. Most changes that occur naturally with aging fall into one of these three categories. Appendix A in the Kennedy text contains a table of physiologic changes that occur with aging. We'll cover these in each specific module. Appendix B covers common lab value changes that occur with aging. It's important not to chalk changes up to aging, though, so that we don't miss a diagnosis. With patients of any age, it is important to consider every lab test you order. What will you do with the information? What are the benefits to be gained by testing? If the test results are not going to change any of your action, then don't proceed with the test. As nurse practitioners, we need to be aware of both pharmacokinetics and pharmacodynamics in all of our patients. There are some changes that may occur with aging that we need to be particularly cognizant of, but no hard and fast rules. We need to be aware of individual patients' health status and specific medications' effects. Renal function typically decreases in patients beginning at 40 years of age, so medications that are nephrotoxic or excreted unchanged in the urine are specifically important to monitor. Renal changes may increase a drug's half-life. Be aware that adverse drug reactions occur more commonly among older adults, with polypharmacy being a major contributing factor. I realize that health promotion, disease prevention is a very broad topic and that we covered a good deal of information in this module's readings and PowerPoint. Providing comprehensive health promotion services is one of the most important aspects of primary health care. In my opinion, these services can make a much bigger difference in many lives than episodic care of illness can. Please become very familiar with the various aspects that should be included in health promotion and make it a habit to address appropriate subjects at each and every patient visit. The case studies that are included in our group discussions this week will demonstrate how to appropriately individualize our approach depending upon patient specifics.